All right, it is 3 p.m. Eastern, so we'll go ahead and get this party started.
Right.
My name is Gilbert Arvizu. I am the student liaison for the Community Health Planning and Policy Development section here within our American Public Health Association. It is National Public Health Week, and it's a tradition for our section for students and the student committee to lead National Public Health Week efforts within our section. Today's theme is violence prevention, and we are just so excited that you all are here to join us. But the CHPPD section influences the design of health systems and policies that are responsive to a changing society, bringing together technical information and the expertise of communities, health professionals, business, and government. We understand the importance, power, and balance of community advocacy. We seek to shift policy in order to eliminate disparities and promote healthy communities in public and private venues. Another cool fact about our section, the CHPPD section, is that about 40% of the policy stances that the American Public Health Association takes is influenced or reviewed by our section. And so with that, just real briefly, a little bit about me. I just recently completed my Master of Science in Healthcare Management from Johns Hopkins University, Carey Business School. So I'm a recent graduate. And I'm also the Community Development Engagement Director at Valley of the Sun United Way, which is one of the largest United Ways in the country. But with that, we'll get right into our presentation today. And I will kick it over to our presenter to introduce himself.
Right. Thank you, Gilbert, and thank you everyone for joining us today. I'm very excited to be presenting for violence prevention during National Public Health Week. My name is Samhar Almomani. I am an undergraduate in Elizabethtown College studying public health and sociology, and have been mostly involved with work related to health equity and sociological epidemiology and violence prevention, which is what brings me today. So very excited to be with every single one, and happy National Public Health Week. Then I suppose I can get to my PowerPoint. So if everyone can see that, this is engaging African American youth in assessing factors affecting their own mental health and well-being, a Photovoice and community engagement approach. So this was a presentation that I also gave in November of last year in Boston for American Public Health Association. It focused on finding new ways to take in recommendations from the community and being able to use those recommendations for actual policies. So I worked on this project with my advisor, Dr. Bob, who is the director of public health, and happy to be sharing that with you today. So the summary statement of need, and which explains why we went about this project to begin with. We were looking at Harrisburg City in PA, which is part of Dauphin County. And we found that African American youth in Harrisburg face challenges that affect their mental health and well-being when you compare it to Dauphin County, again, where Harrisburg City is. A higher number in Harrisburg said that they felt depressed and sad on most days. A higher number said that sometimes I think that life is not worth it. And a higher number responded with, I think I am no good at all. I think I am inclined to be a failure. So that is the specifically youth in Harrisburg, but then African-American males have additional factors that include high number of neighborhood detachment, high rates of gang involvement, and low protective factors. And so just looking at all these factors, we thought that it would be a good idea to sort of look into ways to engage the community to give them a platform to be able to share their thoughts on what would be good policy interventions. All right. So a little bit of background. Dauphin County ranks 44 out of 67 PA counties for health outcomes and 23rd for health factors. It also has the highest percentage of households that earn less than 15,000 annually in the study area, which is the surrounding counties in PA. We also focused on Allison Hill. Now, Allison Hill is a very, very small neighborhood in Harrisburg, and in a recent Penn Life article, it stated that 8 out of 9 homicides in Harrisburg have been in Allison Hill, which is again a very small neighborhood, and that was what also inspired us to look specifically in that area. So Heart of the Hill is one of very, very few reports that came from Allison Hill. And it found that there is youth safety concerns, there is gravitation towards crime, there is low high school graduation rates, and all of these things are serious concerns that the community wants to address. This was in 2015, and again, not a lot of this has been addressed. Safety is also a top priority for Allison Hill residents, specifically in relation to drug and gun crime and violence. Again, we haven't seen much improvement, and there is also increased poverty in Allison Hill, more than Harrisburg, Dauphin County, or Pennsylvania generally. And Harrisburg and Dauphin County have a lower, higher poverty than like the state. So Allison has even more poverty than Harrisburg as a city and compared to the county. So all these factors again gave us more reason to go in and sort of conduct field work to understand those problems more. And just to highlight some of the mental health issues again, there were seriously considered suicide issues, self-deprecating thoughts, so sad that they stopped doing usual activities. And these things lead people to stop being attached to their communities and would lead them to later risky behavior. And so stopping these thoughts from beginning in the first place is the best way to prevent risky behavior. And that's where we wanted to focus our attention. And there are some more factors that were described in the literature. The most frequent antisocial behavior was being suspended from school, which was in Harrisburg 31.6% when you compare it to the 7.1% at the state level. And there was a higher district percentage that is reported being threatened with violent behavior on school property, way higher percentage being attacked on school property and being threatened with someone with a weapon on school property, and a higher percentage bought a weapon to school in the past 30 days. So again, those are some of the factors that led us to come to this purpose of the study, which is to produce recommendations that improve the mental health and well-being of male youth in the neighborhood of Allison Hill, Harrisburg, and the surrounding areas. And we didn't want to sort of go into the community and dictate what the right recommendations are based on our thoughts. We wanted youth-driven surveying, Photovoice analysis, and policy-oriented presentations. Now, Photovoice analysis is a pretty new method, and it basically involves giving the community a way to showcase their daily lives in a media form that helps policymakers understand the problems that that community faces. So all these three methods that we were planning on doing sort of give a platform to the community to talk about their challenges, as opposed to us talking about their challenges. And then another purpose was to come up with a wealth of information that relates to challenges and opportunities for positive youth development in poverty-ridden areas. And it also adds to a growing field of research to improve mental health and wellness outcomes for minorities and underprivileged communities. So this research took place in 2 parts. The first one was a survey that was designed to sort of assess the community challenges, the strengths for positive youth development that influence mental health issues for youth. We focused specifically at the age group of 14 till 19 years old in Harrisburg, and we were able to collaborate with partner organizations in Harrisburg, such as the Boys and Girls Club, YMCA, and a few others. And that helped us find the best ways to recruit participants, because it was a little bit harder to go through the school district system, and finding organizations that are willing to help was a great way to be able to distribute those surveys. And then the second part is the Photovoice that I briefly talked about. This is a guided process when we sort of tell members of the community that we're giving them cameras and a way to share their thoughts in order to help policymakers better understand those challenges. And we asked them to take photos of their community's assets and deficits. And since we're focused on youth, we looked at youth from the community, and we asked them to use their personal smartphones, or they will be given cameras. And we sort of sent them out to take photos again of the things in their community that they think are good and things that they think are bad. And the main reasoning behind this is that imagery is such a major player in advocacy because of the emotions that are associated with visual evidence. I can talk about numbers and show you graphs, but showing imagery sort of gives that emotional layer that helps policymakers understand those challenges more and feel more urgency to actually implement change. And then those changes can also be used as an example for future community youth-driven revitalization in the future. So our research question was, how does the lived experience of adolescent African-American males in Harrisburg affect their overall mental health and well-being? And again, producing recommendations through policy-oriented presentations. And that is not based on our thoughts, but based on surveying and Photovoice analysis. And then the methods that were used, this was a self-administered survey. And the Photovoice part was a multi-step that I will go into later. And this involved a smaller group of males. And then there was discussions and focus groups about the photos that were taken. And to dig a little bit deeper into Photovoice, this is sort of the steps of Photovoice that are usually followed. You form a team. So that would be the smaller group of adolescents that we talked with. You discuss community issues. So again, that would be the good and the bad in the community. We sort of talk to them about the best ways and best recommendations about how to take photos about your community. And then we ask them to commit to being a responsible photographer and then take photos of their community. And then after that happens, we have the discussion where they write captions, come up with quotes, and then they sort those photos, discuss those photos, and then based on those, again, media, photos or videos, they will create roadmaps for changes. And the whole point is to show policymakers and stakeholders in the community those photos. So we would plan a photo event or a photo exhibit and debrief after that event the good things and the bad things and plan action steps. And the important thing is maintaining momentum, because if you look at the very end, the goal is a better community. So we help them understand the steps that go behind the Photovoice process. And these are some of the papers that we distributed. So there's a Photovoice contract that is them committing to the project and acknowledging that they are an expert in taking these photos, and that they recognize that they're taking and capturing photos that accurately represent their community, and they strive at all times to present themselves in a way that they can be proud of. And at the very far right, it's a Photovoice pocket photo release where we can use their photos for the exhibit. And then in the middle is something that we help them during discussions, and it's called the Show It response sheet. And it basically asks 6 questions about what you see here, what is really happening here, how does this relate to our lives, why does this situation, concern, or strength exist, how could this image educate others, and what can we do about it? So those things sort of help guide the discussion when talking about those photos. And so I wanted to share some of the photos here that youth in the area took. I wanted to highlight the one on the right specifically. Shows a property management group with a house for sale. And Allison Hill and Harrisburg generally have problems with neighborhoods with a lot of empty houses, a lot of people leaving these neighborhoods, and that adds to a feeling of detachment. And that is clearly something that people in that community are very aware of, since they chose to take a photo of that. And then some more photos. To the right, you can see the bigger photo of where we saw that sign. And then to the left, that's another neighborhood. And again, these are the communities where the kids, we gave them cameras, or they use their smartphones, and they went to their very own communities. And then here are some other photos. On the left, this is a community garden. And on the right, is a sign about keeping our community clean. And then moving forward, on the left, there's a sign, the Camp Curtin Memory Garden, which is a memorial garden that is dedicated to those who have fallen as victims of senseless violent crimes in Dauphin County. And this was in 2012. And then on the right is a garden that we actually met the person who sort of runs it, Rashida, a major stakeholder in the community. And it's some of these things also help to build a sense of community in the area. And so circling back to the survey, and I will come back to the photos later on, but there were 28 items. We wanted to look into demographics, experiences of racism and discrimination. We wanted to look at symptoms of depression, anxiety, hope, stigma towards mental health issues, adult male role models, suggestions for after-school activities. And again, this survey was self-administered. Sample demographics, sort of what we expected, 30, and a lot of the answers that we were looking for were missing. There was an average years lived in Harrisburg of about 13, but for the most part, it was very, very difficult to get responses just because of the demographic that we were looking for. Again, this was a demographic of adolescent 14 to 19-year-olds in the Allison Hill area or Harrisburg that were willing to both take the survey and conduct a Photovoice analysis. And here are some of the results of the survey. So this shows a protective factor, which means that the more you feel safe in your neighborhood, the more that protects you from risky behavior. And I'll talk a lot more about prevention later on. But this is a good sign about a lot of people feel safe in their neighborhood. And most people agreed that there was just a general feeling of safety. And then this is more spread out, embarrassed to talk about mental health. A lot of people agreed, a lot of people disagreed. So we can see a little bit about the stigma that exists about mental health there. But then the positive thing about mental health is that it seems like people are aware of where to get their resources from. So there's a good number of people, around 60%, that knew how to get mental health help, and more people, the far majority, would want to help a friend that is struggling with mental health issues. And then the number of people that would talk to someone when having mental health problems, again, a little bit more spread out, but the majority would agree to do that. And then about anyone having a mental health problem, the far majority agreed with that statement. And then this is a very aesthetically pleasing graph. And then mental health not being a real illness, a lot of people strongly disagreed, but there is a good amount of people that agreed. So again, this shows out like the stigma that goes behind mental health that is still there. And again, that balances out with the fact that a good amount of people knew where to get their resources, and they would be willing to help someone else that is struggling with mental health issues. And then this is one that I wanted to highlight, and I will get back to later, but the amount of people that wanted to leave their neighborhood was very close to 70%. And that shows a high level of neighborhood detachment, which is dangerous for multiple reasons. The main reason is that it causes an increase in risky behavior, which I will delve into deeper later, but just keep this in mind for now, that the far majority would like to leave their neighborhood. And I wanted to quickly go over the challenges that we faced when conducting the survey and the Photovoice analysis, just because of other people that may want to do similar research with a similar demographic. So passive versus active consent, we had a problem with that. Basically the main difference is that passive consent, the parent would have to sign to opt their child out of the survey, and then with active consent, they would have to sign to agree to opt in the child in the survey. We were trying to get passive consent, but that did not go through the IRB. So that made things challenging, especially in that demographic, because then you would need to get a parent's signature for the kid to opt into taking a survey. And then, as I mentioned, Allison Hill is talked a lot about in a negative way. And so there was not a lot of research or literature that was done on the area other than the Heart of the Hill that I talked about, which was in 2015. There has not been a lot of literature that talks about Allison Hill. And then there are a few challenges organizing with community members. And this was understandable and goes back to the point of people going into the community without meaning to actually help the community, but sort of just building their literature or like just researching and then leaving the community without actually leaving any benefits behind. So there was a lot of suspicion from the community members of why researchers, especially from a town that is 20 minutes away, would come to Harrisburg to conduct research. And then since we were working with organizations like the Boys and Girls Club, there were summer, winter, and fall terms, and we were working on this project year round. So every term there would be a different staff. So it would be very hard to coordinate or build relations with the staff since their staff sort of rotates, a lot of volunteers, a lot of people just willing to help for like one term. And so it was very challenging to sort of keep a constant connection with one or two people. And then this also applies to the groups of students. Again, this is not a school, so the groups of students change often. So this kind of takes away the chance of us looking into any long-term effects. If someone takes the survey, that does not necessarily mean that we can find them to also ask them to take the Photovoice analysis if they wanted. So there was that challenge as well that we faced. And then there was an experience in research organizations. Because we wanted the adolescents to feel more comfortable, we asked the people that are part of the organization to administer that survey. But the people that are part of that organization do not have research backgrounds. And so things like just give the survey to this demographic did not seem that important to them. So that was another challenge that we faced. And then the last one goes to my point about also organizing with community members, which is to show them that this was equally beneficial and this cannot happen in a short amount of time. This is based on long-term relationship building. So we had to also prove that this is an equally beneficial thing for both us and them. And then we also gave out incentives of $5 Walmart gift cards for each survey taken. Some of the lessons that we learned is that most respondents did answer that they strongly agree for questions related to positive mental health thinking, and they said that they knew where to find resources. I will talk about the programs that the youth asked for later in this presentation. And then a majority said that they wanted to leave the neighborhood, but most of them felt safe, and they reported knowing people who encouraged them to do their best and are proud of them. And this shows higher levels of resilience than expected just based on previous studies. And resilience usually counters things that could lead to risky behavior. So things like feeling safe in your neighborhood or feeling committed to your neighborhood, or and like having a strong friendship connection or family connection, those things would be considered high levels of resilience that would counterbalance any risky behavior or negative effects. And here's the prevention part that I wanted to talk about. It is a science, and it includes the risk and protective factor model of prevention. This was used by the PA Youth Survey that we used to sort of compare with. And it's a proven effective way of reducing substance abuse as well as other risky behavior. And this model sort of helps us to look at the problem from a prevention point as opposed to us responding after the problem happens. And that is exactly what the PAU survey sort of intended to do. So we would look at the factors that result in the problem and try to prevent that as opposed to responding later on. And this model is also known to predict increased likelihood of drug use, delinquency, school dropouts, and violent behavior among youth and other risk factors as well. And the cool thing about this model is that you can specifically see each risk and protective factor and what it could lead to. So for example, we could be looking at delinquency, and I will show this more in detail, but we could be looking at delinquency being linked to like a specific behavior or a specific risk. So that allows us to sort of hone in into a specific prevention as opposed to not being sure where to direct our resources. And being able to measure risk and protective factors in a population sort of helps us understand ways to identify and target policies, programs, and other actions that are known to reduce those specific risk factors and to promote the protective factors that will help. And so on the right is the chart that I showed you, where about 70% of people said that they wanted to leave their neighborhood. And then if you look on the left, this was from the PA Youth Survey as well. And it shows that low neighborhood attachment leads to three things: substance abuse, delinquency, and violence. And again, we're focusing on the prevention of violence. And so this is obviously concerning because even though we saw other positive responses, this response leads us to sort of be concerned, but also it helps us by identifying ways or like specific focuses on how to prevent violence from happening. And I want to also highlight other things on the risk factor chart. It identifies peer and individual behavior, school, families, and communities. And it's very handy when it comes to conducting research because based on the numbers that you see, you can link specific risky behavior to those specific factors that lead to them. And that allows you to hone in and prevent that specific thing from happening. Violence specifically is a result of a lot of these things, except depressive symptoms. And that's why low neighborhood attachment was a major concern. And one way to sort of have a protective factor that counterbalances low neighborhood attachment is to increase that neighborhood attachment. And one way of doing that is to increase things that people in that community, specifically adolescents, feel strongly about and want to work with. And so part of the survey that we administered was what would they like to see in their communities? And we had a few answers here: sports or recreation. Those are the top three out of a multitude of selections that they could have picked: science and technology and trade skills. So this sort of allows us to show policymakers what are the main interests that the adolescents have, and this would lead to hopefully increasing neighborhood attachment, which would counterbalance neighborhood attachment that does lead to violence. And that's my presentation. I have contact information in case anyone has questions, and I believe we have time for questions as well, but thank you for listening to this presentation and let me know if you have any questions.
Yeah, there was a question here in the chat. I think it was pertaining to the photos that you shared. Can you share the captions for these, what the kids said about the photos? I don't know if you can speak a little bit on that.
Yeah, we had saved those because we wanted to publish them in like a major photo exhibit like gallery. So we didn't really share those quotes. We at that point, this was in November. At that point, we had collected the photos and we were in the process of getting our first few quotes and starting those focus groups. And so at this point, we're just working on doing more of that, building bigger connections with the community in order to actually build a bigger sort of variety of photos and quotes that relate directly to the findings that we found in the survey. But keep an eye out for when it does get published and shared for the Photovoice photos as well as the captions.
Awesome. Are there any other questions? You can go ahead and unmute yourself, or you can type a question in the chat. If not, I just want to thank you so much for this presentation. It touched on a lot of things that are pressing right now in communities throughout the country.
Right.
You know, and even this theme came up at the annual meeting last year in November was, you know, what does it mean to authentically engage the community? So for you all to be able to use this newer or not as much used method of Photovoice, to be able to give voice to these folks, and then in turn to use those stories and that voice to advocate for meaningful public policy change, I think is really great. I would be interested in that next step, right? Now that you have the photos and the voice and then the exhibit, you know, the influence of that on decision makers, and not just public policy makers, but even local businesses, right? CEOs, those types of things. So so anyway, those are just kind of my thoughts. But again, thank you all so much. It doesn't look like there's any questions, so I'll give you any last thoughts or comments, and then we'll close it out here.
Yeah, I just wanted to thank you for setting this up and thank everyone for attending. Again, if you have any questions or follow-up thoughts, feel free to email me or my advisor. Keep an eye out if you have any questions about Photovoice. I know it's a new method and I would love to see it used more, because it, as opposed to what has not been working in the past, where researchers sort of go into communities and pretend to understand the community's challenges and problems. This method does the opposite of that and asks the community members themselves to be the individuals conducting their own research and literally taking the findings that those community members did and give them to policymakers, and being able to like really hone in on like specific factors. So I would really love to see where the Photovoice method goes from here. And again, if you have any questions, let me know.
Awesome. Thank you so much. I know folks joined a little late, and I know folks and so because folks joined late, we are going to be posting this on our CHPPD YouTube page. So if you always want to refer back to this presentation, you're able to do so. We're also going to send it out through our social media channels and APHA lead. But again, thank you all so much for attending this presentation sponsored by the student committee of the CHPPD section. I hope you all have a great rest of your National Public Health Week. Take care, everyone.
Right. Bye-bye, everyone.